So I'm going to be talking about rabies in South Africa, and obviously because I'm a vet, I'm going to be focusing a little bit more on the animal side, which hopefully is something new and interesting to most of you. So briefly, some basics. Rabies is a viral disease of mammals. It's almost invariably fatal once clinical signs are seen. Virus is mostly shed in the saliva, and so transmission is through a bite, a scratch, or contact with mucous membranes. From there, the virus spreads along the nervous system to the brain, where it causes inflammation, resulting in death. It is, however, entirely preventable, probably the only good thing about rabies. As state vets, we deal with it quite a lot because it's designated as a controlled animal disease in South Africa. And this is mainly because of its zoonotic potential, so it's for public health reasons. The clinical signs are fairly similar in all infected mammals, although certain species have typical clinical pictures that are often seen in that species. So I'm going to use the example of a dog. On the left here is an old illustration, I think it's an engraving, that shows a really classic presentation of a rabid dog. So its head is hanging, it has like blank staring eyes and saliva dripping from the mouth because of paralysis of the muscles that would allow swallowing. These dogs are often aggressive, but they could also be lethargic and depressed. The common factor is that there's usually a sudden change in behavior or in personality. However, especially early in the course of disease, the animal could present with non-specific signs like fever or vomiting. And then something that we also see fairly often is as the throat muscles start to get paralyzed, the dog makes choking noises, which leads the owner to believe that there could be something stuck in its throat. And sometimes they get exposed by putting their hands into its mouth to try and remove whatever they think might be in there. This map shows all the animal rabies cases reported in 2017 and 2018. And it shows a pretty typical situation that's been seen in the country for the last few years. So the solid orange circles show cases in dogs. And you can see that most of these occur in the eastern half of the country. The drier western half has mainly cases in wild animals, especially in bat-eared foxes. Those are the solid blue triangles. And then there are also the black-backed jackals. I'll talk a bit more in detail about this later. They're represented by the black squares. They're in the Northwest province and some in KZN. So rabies has been in South Africa since before recorded history, but only a specific biotype that's been adapted to be maintained in populations of yellow mongooses in the central part of the country. There were no canine rabies cycles in South Africa until it was introduced repeatedly from neighboring countries in the 1950s. After that, we saw cycles popping up in the jackals and the bat-eared foxes. And molecular analysis of the rabies viruses from these species show that they've become maintenance hosts for their own biotypes of canid rabies that was introduced by the dogs. So the biotypes from dogs, jackals, and bat-eared foxes are all more closely related to each other and to rabies biotypes from Europe than to the original yellow mongoose rabies. In the past few years, we've also seen more cases in aardwolves, mostly in the Northern Cape and in the Karoo. And it's believed that we may be seeing the beginning of a new maintenance cycle in these species, but time will tell. Okay, so here's a map of the areas in which rabies cycles are seen in the different maintenance hosts. In the western half of the country here, as I mentioned earlier, the green is bat-eared fox cycles. Yellow mongoose rabies mostly occurs in the central Free State. And there are jackal cycles here in yellow in the Northwest province, a little bit in Gauteng, and here in KwaZulu-Natal. Dog rabies is endemic in eastern Limpopo, Mpumalanga, along the coast of KwaZulu-Natal, and in the eastern part of the Eastern Cape. It also appears, we see quite a lot of cases popping up here in the Free State along the border with Lesotho, And so it appears to be, it moves across Lesotho and is repeatedly introduced across this border as well. So a little bit about why we see rabies cycles establishing in certain species of animals, but not others. If we look at bat-eared foxes as an example, their behavior has several features that make it easy for rabies to be transmitted between them. So they're very sociable. They have overlapping territories. They often share dens with other family groups of bat-eared foxes and even with other species of wild animals. They live together in close contact. They sleep close together. They often engage in mutual grooming that involves licking each other's faces. And they also seasonally disperse to find new mates or new territories, which gives the virus opportunities to move constantly to infect new naive populations of the same species. Rabies does also affect many other animal species, even if it doesn't establish endemic cycles in their populations. We often have reported cases in quite a number of wildlife species, especially various mongooses, Cape foxes, duikers we see fairly often, polecats sometimes too. And then livestock are also often affected. This picture here, it's a still from a video, so it's not great quality, but it's of a rabid calf. And you can see here the typical salivation. The calf was standing and just bellowing repeatedly and charging at the person that was behind the camera. And then domestic cats, when they're infected, they're usually extremely aggressive. They're known to latch onto people with claws and teeth, often onto the face, and they don't let go until they're killed. Then some species that are seldom infected, they include those that are smart and risk averse enough to avoid other animals that are acting strangely, so any sort of primate. And then rodents and dassies, they are so small that they're unlikely to survive a bite from a rabid animal long enough to develop rabies. This doesn't mean that cases of rabies are unheard of in these species. There have been some in the past, but they're just very rare. Okay, so what are we seeing currently? This year, if you compare it to the cases we saw in 2019 and 2020, there's been quite a dramatic increase in the number of rabies cases reported. There have also been 11 confirmed human cases. These are all from areas where dog rabies is endemic. And these numbers are good for relative comparisons between the years, but they definitely don't represent the full situation of rabies in the country because cases are underreported for many reasons. So if we look a bit more in detail at some of the provinces, here's a map provided by KZN. And the red and yellow dots are all positive cases of rabies, and the black are samples that tested negative. So you can see that there are extensive outbreaks going on in a lot of the coastal cities and towns. You can also see the majority of samples are coming here from the Durban area and along the N3, where it's easily accessible. So there are a lot of areas where very few samples are taken, and so the true extent of the situation in the area is not known. The blue stars, there's one here and two here, are the human cases. And they're also in the areas where the most animal cases are also being detected. So people in that area are aware of rabies and the health facilities in the area are aware of rabies. So it's possible that there are others outside of these areas that are not being detected. In the Eastern Cape, dog rabies used to be confined to the eastern part of the province. But just this year, large outbreaks have exploded in East London and in Gqeberha or Port Elizabeth, where there have been 68 cases reported in dogs as of the end of September just this year. And again, the blue stars are mainly in the major cities where the human cases have been detected. So in the Western Cape, we previously had an average of 13 reported wildlife cases every year. This year, the wildlife situation is pretty much the same. You can see the bat-eared fox cases dotted around the province. We also had 2 aardwolf cases in the Karoo, a feral cat, and a cow in Swellendam. However, what is very different is we've had 4 confirmed cases of rabies in domestic dogs in Cape Town. With the unusual outbreaks happening elsewhere in the country, it's not a surprise these cases have occurred. We unfortunately don't yet know the source of the cases. 2 of the dogs had lived in Cape Town their whole lives in enclosed yards. One was a stray found on the beach, so we don't have a history. And one belonged to a man who traveled back and forth from the Eastern Cape, and he used dogs for huntings. So that's the only known link at the moment to an area where there are active dog rabies outbreaks. We are working on sequencing the viruses, but for several reasons, unfortunately, it's a very slow process. So why am I talking about dog rabies so much? Because rabies in dogs is the cause of 99% of human rabies cases. Dogs live in close contact with people, so they're the most important species to look at in terms of public health. Because as people move around, they take their dogs with them. A new cycle of dog rabies could establish anywhere where there's a big enough population of unvaccinated dogs. Dogs, like I was talking about with the bat-eared foxes earlier, they're a very sociable species, and they interact with each other in a lot of ways that would allow rabies to spread easily between them. Even a dog like this one in the picture that's kept in an enclosed yard, a lot of people are under the impression their dog can't get rabies if they keep it in their property. But all it takes is one rabid dog to run down the street, all the dogs come out to bark and get nipped on the nose through the fence, and the whole suburb's infected. What we do about this, vaccination of pets is the #1 thing we can do to prevent dog rabies cycles from establishing. It's the legal responsibility of dog and cat owners to actually have their pets vaccinated against rabies at least every 3 years. But we from State Veterinary Services try to assist with this. We do free vaccination campaigns in communities that can't access private veterinary services easily. We also provide free vaccines to animal welfare organizations that perform the same function. Our annual target from Western Cape government is to provide 70,000 free vaccines. And then how we vaccinate, well, rabies actually has quite a low R0. It's between 1 and 2, but in many situations, it's very close to 1. So a high percentage of vaccination coverage is actually not necessary to have herd immunity in a dog population. The more important thing is to have an understanding of how rabies would spread in a specific area, and then to vaccinate strategically in that area to create buffers and barriers to that spread. And then, of course, awareness is a very important component of rabies prevention and facilitating vaccination. And we use all the methods at our disposal to do that. Here in the picture is our Minister of Agriculture, who is helping out at a rabies campaign day and going through an activity book with some kids about care of dogs and prevention of rabies and that sort of thing. I wanted to touch very briefly on population control, because sometimes people ask why we don't just round up and get rid of all the dogs on the street. Culling strategies are something that's been used in the past to try control rabies, even in South Africa. They're still used in some parts of the world, but they don't work. And this is because once rabies is endemic in a population, if the animal population is not completely eradicated, it will increase in number again quickly enough to provide the virus with all the hosts it needs to be able to continue spreading. And then culling obviously is unpopular with people who have dogs or like dogs. So it will cause them to hide dogs, move their dogs around, possibly spreading rabies to a new area, and then just generally to distrust authority and to be suspicious of vaccination campaigns. So it really undermines any sort of prevention that we're trying to do. The other thing that I should mention is that South Africa does not actually have very many stray dogs or street dogs like occur in other parts of the world. We have many free roaming dogs, but almost all of these dogs are owned by somebody. Population control in the form of education about responsible pet ownership, and this includes sterilizations, can definitely help. But in general, vaccination is the best and easiest rabies prevention strategy, and that should be the #1 focus. Another important prevention tactic is to follow up on animals that have been exposed to a rabies case. If a dog has been previously vaccinated, it can be vaccinated again, similar to a human, and that'll prevent rabies from developing. If it hasn't been vaccinated, just vaccinating it after the exposure is not necessarily going to prevent rabies from developing. And the use of immunoglobulin is not recommended in animals. So the animal should unfortunately be euthanized. It's possible, instead of euthanasia, to keep the animal in quarantine and observe for signs of rabies for 6 months. But in this situation, the animal must have absolutely no contact with people or other animals, which is difficult for an owner to do. And it's also really not good for the welfare of the animal. And because the incubation period of rabies can be very long, it's even possible for rabies to still develop after 6 months have passed. So the owner must really be aware of the risks and their potential liability before they choose to go this route. Okay, so the plan for the future, we are buying into the 0 by 30, which is an international goal to end dog-mediated human rabies deaths by 2030. The way to do this in South Africa is by focusing on strategic vaccination in canine rabies endemic areas, as well as awareness and post-exposure prophylaxis for people. There are, of course, a lot of challenges in achieving this goal. There's unfortunately not a lot of political interest when it comes to rabies or to animal diseases in general. So budgets and human resources are always lacking. Another really big challenge is the safety of field personnel. Some of the areas where dog rabies is particularly bad in KZN, for example, are areas where rabies vaccinations haven't been done for years because vaccinators are repeatedly hijacked whenever they try to go into those areas. However, we're going to keep trying. Rabies can and it should be prevented. And the cost of doing so is really so very small compared to controlling rabies in humans and the cost of controlling many, many other diseases. For example, it costs less than 5 Rand per vaccine dose for a dog. So it's definitely doable. My last slide, I just wanted to touch on rabies prevention in wildlife because we do still care about them, even if dog rabies is more significant for public health. It's possible to do individual rabies vaccine injections, especially for high-risk populations of endangered species. But this is pretty labor intensive and it can be risky for the animals in question. So for instance, if you want to protect a pack of African wild dogs, you would have to dart all of them and then inject them with the rabies vaccines. And this comes with, it's general anesthetic, it comes with the risks and a lot of stress for those animals involved. So you really have to weigh up the risks and the benefits. Another option is oral vaccines, which are placed inside a bait block. And how that works is the vaccine comes in a blister pack like this. And when the animal bites into it, it pops and sprays vaccine onto the mucous membranes on the inside of the mouth. These have been used very successfully in other parts of the world, and they've pretty much eradicated rabies in European red foxes. Unfortunately, potentially using them in South Africa is a real challenge. Most of the vaccines are not registered for local use here, and so we'd have to do local research before this would be considered. The companies that manufacture them haven't shown a whole lot of interest in supplying the vaccines to South Africa unless they can be assured of future sales. There's also the question of whether the baits will be consumed in the right way by local wildlife. For instance, will a bat-eared fox bite into the blister pack the same way a red fox would, and would it actually work? And then because it's a vaccine containing a live virus vector, there are safety concerns about baits being picked up by people or by animals that aren't the target species. So that's something that has to be managed very carefully. So basically, it's something we'd like to do, but it hasn't been feasible yet. Okay, that's all from me for today. If anyone has any questions, I'll do my best to answer them.
Fantastic, Lesley. Thanks very much indeed for a wonderful presentation. If you can stop sharing your screen, and then we can see you. And
Yes,
colleagues, if you can, thanks. The raised hand button for anybody who'd like to ask Lesley a question. Perhaps I can start off while people are thinking, Lesley. It seems strange to me that there aren't more dog cycles in the Western Cape. Is it just a matter of, potentially cycles just being stopped because of the rural nature? Is it because, is there some climatic issue? I'm not quite sure why there's this difference in the country.
Yeah, you and me both. It's just something that we're speculating about at this stage, but it really does seem that rabies has been confined to dogs in the eastern parts of the country for a very long time. And we don't know if that's because of, like you say, climate conditions or just human behavior in those areas or anything else. It is concerning that we're seeing these really big outbreaks in the cities of the Eastern Cape that we haven't seen before. So that could be an indication that the epidemiology is changing, but this is something we'll only know with time.
Well, thanks very much. So I got 3 hands up, but I just wanted to put one other question, which I may have missed. I'm sorry, but has there been any change in the recommendations for who should be vaccinated pre-exposure vaccination in humans?
Not that I know of. I mean, human health is obviously not my field of expertise. But as far as I know, it's required, well, it's recommended for all vets and people who work in close contact with animals all over the country. So yeah, me and all my colleagues should be getting vaccinated regularly.
And that oral vaccine that people can, that the animals can chew into, that's not an option for humans?
I really don't know about that. Okay. I think it could potentially even be dangerous for humans because there's a live virus vector in there. I mean, there are a number of different vaccines, so I don't know about all of them, but
okay.
Especially in immunocompromised people.
Okay, great. So I have Nectarios, Sean, and Stephen in that order, please.
Thank you very much, Lesley, for the great presentation. I've just got a question with regards to, you were saying if your dog is exposed that has been vaccinated, you should vaccinate the dog again. But I'm just wondering, like in certain locations where people aren't at home and this rabid dog walks past and there are all these other dogs there, and then the dog gets bitten, you won't really know about it. So then what should you be doing in that case? Thank you.
You should just be keeping your pet's vaccinations up to date. So every dog should be vaccinated at the age of 3 months, and then again before the age of 12 months. And then the recommendation is at least every 3 years, although it does depend on the specific vaccine. But it also depends on the risk in that area. So in higher risk areas, we recommend vaccinating once a year, and that should be sufficient to protect a dog.
Thanks very much.
Thank you very much.
Hi, Lesley. Thanks very much for a really great talk. Can I ask you about bats? So, I mean, they're the kind of classic transmitters of rabies. You hear these stories of getting a lick from a bat as it just flutters past you. Given that there's this inverse relationship between the size of an animal and the latency period, before the virus reaches the animal's brain and causes fatal symptoms, why are bats such efficient transmitters of rabies? I've never really understood this.
I don't know. Really, that's the answer to my question. Bats in South Africa, I'm not an expert on bats and the viruses they carry, but rabies doesn't seem to be something that bats in South Africa really carry, but they carry very closely related viruses that can basically cause the same clinical picture as rabies does. But yeah, the bat research people will definitely know a lot more about that than I do.
very much. Stephen.
Hi, first, thank you very much for talking to us, Lesley. This was a really good talk. Just to partially answer Sean's question, bat rabies, as in rabies itself, seems to be limited to the North and South Americas. Other rabies-related viruses have formed the lyssavirus niche in bats elsewhere in the world. So the Australian bat lyssaviruses and the Caucasian bat lyssaviruses. In South Africa, we've got Lagos bat virus and Duvenhager virus in the bats. Yeah, so that's just a comment there. Lesley, if post-exposure prophylaxis in humans, if the vaccine is so effective, why is that not the case in dogs? And obviously, giving immune globulin to dogs it's a hugely expensive exercise. But is the dog immune system so different to humans that post-exposure prophylaxis by vaccination doesn't work?
I'm not really sure, Stephen. I don't think that people have done a lot of research on use of immunoglobulin in animals because the risk is just too high. You just don't want to run the risk of a dog developing rabies and spreading it to more people. So I don't think that there is a lot of information out there. I could be wrong. Oh yes, there's a comment here, you would need canine immunoglobulin. Is that necessarily the case, considering that they use equine immunoglobulin in humans? But yeah, I think basically there's not enough information on it. It's a very risky situation, and so we would rather just go with euthanasia.
Thanks, that makes sense.
Okay, I don't see any further hands up, so perhaps I could just ask one last question of you, Lesley. I was a bit concerned to hear that domestic cats can get rabies, and I was not daydreaming, I was considering whether I would wake up one day to find Miss Toffee claws and teeth in my face. Are cats immunized against rabies, and should I take her off to the vet?
Yes, definitely. So cats, it's exactly the same as for dogs. They are required by law to have their rabies vaccinations maintained. So if she hasn't had a rabies vaccination in a couple of years, then definitely to the vet she should go.
I can sleep soundly. Sorry, Sipo, I think, has his hand up for the last comment or question.
Yeah, no, thanks, Mark, and thank you very much, Lesley. Just a question from me. What are your thoughts just regarding why our sort of campaigns for vaccination in the Eastern Cape and KZN haven't been successful? I think you've highlighted, some of the challenges just politically and human behavior. But theoretically, if all of those were overcome, do you think that we would eliminate rabies in our domestic dog population to an extent of what we're seeing, say, here in the Western Cape and in the Northern Cape? Or is just this something that we have to live with and just continue these campaigns in perpetuity? Thanks.
We absolutely don't have to live with it. It's entirely possible for it to be eradicated in those areas. In fact, KZN did almost achieve it. I think it was back in 2014. They got a massive grant from the Gates Foundation. And basically, if you can throw enough money and if you can get the politicians on board, which they did at that stage, they brought the rabies cases down to, almost an undetectably low level. And then a few years ago, when the funding for that project ended, the amount of animals being vaccinated just crashed, and the amount of cases in people and animals just slowly came creeping up again until it's at where it is now.
Okay, no, thanks. Well, we hope for